Today I wanted to talk to the members in the audience about healthcare disruptors, those key elements that are changing healthcare, healthcare delivery, and health law. The key to influence the healthcare market is through administrative advocacy. That's working with your state-level Department of Health and Human Services, or the equivalent, as well as the federal government's Department of Health and Human Services. Many organizations have a legislative strategy where they work with members on the Hill. And there's nothing wrong with that. It's just in this uncertain environment where there's a lot of gridlock in many communities, that key is not going to move the needle or move the needle fast enough. So the voice of the provider, the voice of the consumer, is best heard through administrative advocacy, and that's engaging with the executive branch offices, and again, the state equivalent, to share what's happening in the environment, what issues are coming up, and use that as an opportunity to make sure your voice is heard. I know from a federal viewpoint, that CMS is very interested in hearing the voice of the provider, the voice of the consumer. Right now, they've reached out to seek changes in Stark and in anti-kickback. I use that as an example because I think it's important that folks realize that the agencies do listen. Change is hard and change is slow, but they do listen, and they can't hear you if you don't raise your voice. Many providers don't. Maybe they think it's too expensive or they think that the government won't hear them, but they do. They read the regulations, they read the comments. When I was in the government, I know. And as I said, it's a way to raise the voice of the consumer, the voice of the provider, those who have their boots on the ground. Make sure your voice is heard. And so everybody ought to have, as part of their arsenal, a strategy to engage at that level. And so yes, we call it administrative advocacy.